Now we get into the nitty-gritty stuff. We got a lot of muscles that we got to memorize and within a week that will be important for you in your later lifetime as a nurse or in the health profession. These two slides that we have here detail pretty much everything, all the muscles that you will probably need to know, with maybe one or two extra ones that are here or shown that aren't really needed. However, for us, if you don't really have much time, these are the muscles you want to look over. You're not going to get 100% on the thing, but you will get a good average, as good as 76%. What we will be going ahead discussing, I'm going to rip apart these muscles in greater detail here in a little while. Let's go ahead and begin on the upper portion. We're going to be talking about the muscles that produce facial expression, movement, and all that good stuff. We're going to work our way down from the superior portion down into the inferior portion. Beginning with this very tippy top muscle right here called the occipitofrontalis muscle. This naming here is just referring to the location of this muscle, the occipitofrontalis. If you'll remember that this bone back here is called the occipital bone, while the one right here is the frontal bone, the occipitofrontalis spanning this entire thing with an epicranial aponeurosis, which just means a tendon, almost like a sheath of connective tissue here, just above. Apo means above, neurosis being above the nervous system. Epicranial aponeurosis with the occipitofrontalis muscle connecting with it, with a frontal belly and occipital belly. If we're to progress downward, more laterally, we'd see a temporalis muscle. This temporalis muscle is also using the location form of the nomenclature. It's right above that temporal bone, or its major body, muscle body or muscle belly, being over that temporalis bone. It sneaks underneath that zygomatic arch and inserts into the mandible, which at this point you don't need to know the insertion point. Just know that based on the arrangement of these fascicles, that this particular muscle will be chewing, helping with chewing and moving that jaw closed. If we progress down from this temporalis and come into contact with this glorious beauty right here, it's called the masseter. Those of you that are familiar with the word mastication, you will be able to go yippee huzzah hurrah, because this will make this muscle very easily remembered. Masseter is for masticating. Masticating is a fancy way of saying chewing. That masseter is one of the primary movements, or the primary movers of that jaw. You can see those fascicles are arranged in a way that will close that jaw. It's on that angle of that mandible that'll help close it in that appropriate way. If we move back over to the side from the occipitofrontalis and the temporalis over to here, you'll notice this very circular muscle. Remember that when we are naming things, orbicularis refers to circle, and then this name also takes advantage of its location, oculi. It's in the ocular region. Those of you that are familiar with the word ocula or oculi or ocular, you'll be able to know that it refers to the eye. This is there to help blink. The levator papilla superioris is the one that has the primary role of opening your eye, and the orbicularis oculi has a nice role in helping close it. Because we talked about an orbicularis, let's go ahead and move over to another orbicularis on the face. We've got the orbicularis oris. Again, it's a nice circle or circular belly, but the oris refers to oral or mouth. So orbicularis oris is circling around that mouth. You got a lot of muscles attaching to this orbicularis oris, because you can see that this helps with the expression of the lips, smiling, frowning, and all that stuff. One particular muscle that you're going to care about, or you can see that smiling muscles right there, is the zygomaticus major and zygomaticus minor. If you can tense those muscles up. That'll draw up your lips up, along with this levator anguli oris will also help out with a little bit of that. Lots and lots of muscles necessary for smiling, as you can see. Let's go ahead. I'm going to descend a little bit early on to help out with the expressions that you'll see with the lips. I'm going to go ahead and descend down to this one, the platysma. Platypus has a flat tail. This muscle is very flat, and when you'll see that it comes up and inserts quite nicely into that bottom of that orbicularis oris, and will draw the lips down when it's activated, like so. When you go cringy, that word platysma is going, it's helping you make that cringe. Or if you're afraid or if you're angry, it helps to draw up those muscles in that neck and give you that angered look. If we were to take a side look at that orbicularis oris, you would see this particular muscle right. Where is my buccinator? There's my buccinator, nice and deep to that muscle is the buccinator. That buccinator is the muscle that, since we're talking about the oral cavity, helps with keeping your food not stuck between your cheek and your teeth, but on those teeth and helping them grind. It also is responsible for helping you accidentally chew on your your cheek, and be sore for the rest of the day. It also, if you notice, it has those fascicles lined up in a particular way. So when you go and you draw your lips back with a cringe smile or a fake smile, that helps draw those points of those lips back. It also draws it back to help buccinate or bugle, and helps blow that horn, those air horns that you may have, such as a saxophone or a flute or a trombone or something like that. We're going to go ahead and dissect just a little bit deeper into the skull. This will be one of the last muscles. We've talked about two muscles that help with chewing. We got the masseter and temporalis. Well, now we got ourselves this lateral pterygoid. The P is indeed silent, just like the pterodactyl, lateral pterygoid. What you will see that it is inserting into that bottom portion of that head, and it's inserting, well, origin is in that bottom portion of that head, the maxilla, and maybe a little bit of that sphenoid, ethmoid, and all these other bones. We'll talk the unnecessary information there. But it does its insertion point into that portion of the, just behind that temporomandibular junction, that allows, if it pulls appropriately, will open up that mouth. Okay, the muscles of the eyeballs will be the last thing that we'll be discussing for the head. These are some really super duper important points because we will be discussing them multiple times over. Not only just here in this lecture, but again in the lecture about the cranial nerves, as well as again in the next lecture about the special senses when we talk about sight. You have 6 muscles that help move the eyeball. All of which are named, 4 of which are named in a way that makes it really super easy to remember. Rectus, remember, is parallel to that of the midline. And what you'll also, the directions or locations where they are indicated here as well. Lateral rectus, medial rectus, inferior rectus being down here, this little glob here, and the superior rectus being up here. What's beneficial about this is if they contract, those muscles that have those muscles and their names indicate which way that eyeball is going to rotate. So if you contract that superior rectus, the eyeball is going to rotate superiorly. So this portion, so that way you can look up. If you want to look to the side over here for this gentleman or gentlewoman, the lateral rectus will contract and pull that eyeball, rotate that eyeball this way. Inferior rectus, guess which way it's going to rotate that eyeball? It's going to rotate it down. Medial rectus is going to rotate it into the middle. You do have 2 other muscles that are a little bit counterintuitive as to what they do. They are the obliques. The name superior and inferior oblique just refer to their position in the eye socket, the inferior being on below, the superior being up above. The superior oblique, you'll see, is feeding through this trochlea, this ligament. That way it can redirect the movement of this muscle and what effects it has. If it pulls down on it, you will see that superior rectus will try and rotate it, the eyeball down inferiorly and more medially, while the inferior oblique you'll see is anchored or origined here with an insertion point in the lower portion. If it were to get tugged, would cause an inferior oblique to go more laterally and inferior as well. Let's go ahead and take a look at this in a more anatomically appropriate look. There's that superior oblique coming around, and there's that trochlea going ahead and helping redirect that superior oblique. You got that inferior oblique working its way just underneath and inserting just underneath that lateral rectus. There's the superior rectus and the inferior rectus, all of which inserting into some portion via tendons into that fibrous tunica that we'll be talking about when we talk about special senses that help rotate that muscle. You can't really see the medial rectus. It's way in there. Just barely see it in that darkness. We won't be talking about any of the muscles of swallowing. That isn't really any of the things that we can really talk about in such a brief detail. And to be honest, to try and talk about all the muscles inside the body all at once in this one lecture would be asinine. It wouldn't be worth our time. It would be extremely foolish. And it really does need more time. So unfortunately, this is one of the things that we do need to forego. Again, a lot of foregoing of these muscles. We're going to finish off this head portion with the neck. I apologize, I said something else earlier. I am lying again. I'm going to go ahead and point out just a few muscles that help turn the head and move it, only because it's really fun to say. You got the sternocleidomastoid. Let's see if we can't find a better picture of that really quick. You got the sternocleidomastoid here, inserting into the top of that sternum, wrapping or rotating around the head and inserting into the posterior portion, which hence why it's called the sternocleidomastoid. It inserts into the sternum. Cleidomastoid because, well, reasons we're going to say for now. Notice the organization of those fascicles. If you were to put your finger on the insertion point and origin point, or insertion point being on the head and the origin being on the sternum, you're not moving that sternum very easily. And you were to pinch down or try to move your fingers together or try to oppose your fingers, you would easily find out which way that sternocleidomastoid tries to move that head. There's that platysma again, that most superficial layer of muscle on the neck and up lower jaw. There's just a couple more we're going to point out. The trapezius. I'm going to go ahead and revert back to that major overbody picture. That trapezius, the most superficial posterior portion muscle. You can feel them. If you were to feel your upper shoulders and give it a good pinch, those are your traps. You'll see that the fascicles are very wildly distributed in different ways to help in the multi-directional fashion, but you'll see in the neck that it does have an anchor in pulling back the head or having you look upward. There are a couple more muscles that are in the back of the head. While I was rotating there, sternocleidomastoid, quick little cool thing about the sternocleidomastoid is if you follow that muscle and push it off to the side just a tiny bit, you should be able to find your carotid pulse. That carotid pulse, there's the carotid artery there. That darker hue of a red, scarlet red, is that carotid artery. You just have to push that muscle just a tiny bit back, and not too far back actually, just a tiny bit. And you should be able to feel that little dump, bump, 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 bump thing going on to your pulse. last couple of muscles, we've just peeled away the trapezius. It's no longer there. We've peeled away a lot of other muscles. We've got the rhomboid major and minor. Notice that a lot of these muscles are attaching to the spinous process of those cervical, not arteries, forgive me, cervical vertebrae. And that explains why you don't really feel that bifurcated spinous process in your neck because of all these muscles in the way. Sternocleidomastoid, and you can see that again. Just underneath that is your splenius capitis. Notice how it inserts into that spinal cord. You are not moving that spinal cord whatsoever. So the origin point is on that spinal column, that vertebral column, forgive me, and its insertion point being up in the skull. Again, if you were to put your thumb and on the origin point and your finger or pointer finger on the insertion point, and then were to draw those two together, you would be able to figure out which way that splenius capitis is pulling. Spinalis capitis, you can see it has a nice interesting array of muscles with a couple of other muscles merging into it, the longissimus capitis being one of them, and other muscles inserting as well. With that, that is the end of our discussion of the muscles of the head and neck that we care about, and I will catch you all in another time. Remember, you got this.